Oh, Milo's on here? All right, Alan, let's shut it down.
We're out. Denise Koo is currently the Director of Patient Education at SeamlessMD, where she leads a team that designs interactive, accessible online programs that guide patients in real time through their surgical self-care journey. She specializes in designing for health literacy, health behavior change, and accessibility. In the past 12 years, Denise has designed over 400 resources and programs for healthcare organizations across North America. She's worked at almost every teaching hospital in the Greater Toronto area, and her programs have been shown to drastically improve patient satisfaction, reduce readmission, length of stay, and unnecessary emergency visit after surgery. Denise holds a Bachelor of Science in Nutrition and Food and a Master's of Health Science in Nutrition Communication from Ryerson University. This is Denise's second time on the SeamlessMD podcast. Her first episode was episode number 8 on incorporating health literacy and accessibility into digital patient engagement. If you haven't already listened to that episode, go check it out. It covers a lot about the importance of designing digital patient engagement and patient health education with health literacy and accessibility in mind. Today, we're super excited to have Denise here again, this time to share more on using digital patient engagement for total joint replacement surgery. Denise, welcome back to the show.
Thanks, Alan.
Josh, I wasn't sure. Josh, I wasn't sure if you were going to talk or not.
I always get stuck after the intro. I don't know if I'm supposed to jump in now, jump in later.
We can do that again. You can welcome me again if you want.
Well, Denise, you're always welcome on the show. I like it. Yeah, I'm going to roll with it. So Denise, we wanted to talk with you today specifically about total joint replacement surgery. We know you've done a lot of work with SeamlessMD in designing these programs. And so we thought, your expertise in this field would be vitally important to share with our audience as well. Where I thought maybe we could kick things off, whenever we do a new implementation, and Denise is super familiar with this, we always interview our patients to understand what topics would be important to them to cover. And these are patients who have already gone through a surgery before, so they know kind of all the pitfalls and all the different concerns and topics that were important to them. With total joint replacement surgery, so like knee replacements and hip replacements, for instance, what were some of the topics that were important for patients to cover in the digital program?
Yeah, I think talking to patients before we started designing the program, I learned a lot about their journey up to where they got to the point where they were scheduled for surgery. Oftentimes, patients have been suffering with pain and lack of mobility for a few years before they get to the point where they're scheduled for surgery. And so what's top of mind for a lot of them is really their hopes and expectations of finding some semblance of normalcy, some ability to kind of return back to their normal levels of mobility. A lot of patients like to talk about, their hopes after surgery to, for example, like walk their daughters down the aisle, or to be able to get down on their hands and knees and play with their grandchildren, or to return back to their favorite sports. For patients, this surgery is really key to helping them get there. And that's often what's top of mind. The other thing that we often hear, though, is there is a lot of anxiety patients express about taking opioid pain medications after surgery. I think on the news, we hear a lot about the opioid epidemic. And for the patients, they have, I guess, a lot of anxiety regarding how much pain medication they need to take after surgery, but at the same time, they want to be able to really manage that pain well. So that's really top of mind for them. And a lot of what we do at Seamless is to help educate patients on how to take their pain medication safely, and the difference between opioid and non-opioid medications, and how to take the different types of them to manage their pain. So yeah, those are two of the most common things that we hear from patients when we talk to them.
Hey, Denise, I'm wondering, what's your sense of what most hospitals are actually providing patients in terms of like normal education around like opioid use?
Mm-hmm. Yeah, from what I've seen in some of the original print resources, there's usually like a paragraph about managing pain medication. So like, take this medication every X amount of hours. If there's not enough pain control, then take this second medication. A lot of the specifics of what to take and how to take is actually provided verbally to patients, either by the surgeon or the pharmacist. So not everything is written down, and definitely there's not someone there who's coaching them through it day by day on an app. So there's a big difference on what patients typically receive and what we provide at Seamless.
Yeah, I even think about even like I'm a like relatively like young, healthy person, and you know I'll forget anything that I don't write down, like even like day-to-day work. I can't even imagine
Same.
it. Yeah, if you're in hospital and you've just had a major surgery and you're still kind of not your full self, and I don't know how anyone remembers that stuff when they go home. To be honest, seems pretty rough.
Yeah, we actually hear that a lot from patients as well. Is that during when they were receiving instructions from the clinical team, either they were super stressed and they were blanking out, or they were actually already on a lot of meds, which was actually affecting their ability to remember and focus on things. And so they really appreciate the additional reinforcement and reminders later on when they actually need to apply that instruction, and they feel more confident that they're doing the right thing.
I also wonder how many patients, like as in terms of like our average patient, even knows the difference between like a non-opioid and an opioid pain medication. Like I wouldn't be shocked if there was just a lot of like lack of understanding about the differences between the two. Um,
Yeah, it's actually very common, I think. Like even talking to my own friends and family who don't work in healthcare, often there's a lot of confusion about, what is safe, what is not safe, what is opioid, what is not opioid. It's just something that we don't often see explained in the media. So it's really important education, I think, for these types of surgeries.
I think also, Denise, to your first point that you mentioned about the concern being they want to be able to use their, let's say it's a knee or a hip, to be able to walk their granddaughter down the aisle or play with their grandchildren on the floor and things like that. From my experience, that's so overlooked because that's what the patient cares about. Whereas in healthcare, we care about oftentimes outcomes and clinical outcomes and not necessarily functional status, like being able to bend your knee so you can play with your kids and things like that. I think that's really unique, and it's definitely an insight that patients would have more so than healthcare providers necessarily. Um, are there anything in particular or any specifics that you've put into the SeamlessMD platform to address some of these topics? So like, let's say the getting back to normal function, or also the opioid and pain management?
Yeah, so we do a few things to address it. In terms of getting back to normal function, we actually send weekly emails to patients so they know what to expect week by week. And we also track their progress week by week so they can actually see, on their charts, on their graphs, how they're progressing towards their goals, which will allow them to kind of achieve the dreams and hopes that they had initially. So the other thing that we typically provide weekly updates for patients is when it's safe to start different activities. So we start off right after surgery by telling them, it's safe for you to, brush your teeth and do like light daily things, get dressed by yourself, get in and out of bed by yourself. And we slowly, week by week, let them know, now it's safe for you to go for a walk, and now it's safe for you to start different activities. So it actually gives them reassurance that they're making progress through time, and it lets them see the light at the end of the tunnel, which is really
Right.
important.
I think it's neat
so
that you're taking it all the way to the micro amounts. So like brushing your teeth, for instance, that doesn't seem like
Yeah.
to any regular person that's not like a difficult task to do. But after a surgery,
Mhm.
it's totally like it's so overwhelming, all the different functions that you're not able to do. So it's almost
Yeah,
motivating in that way.
yeah, exactly. It's definitely reassuring.
I think one of the other things that makes total joint replacement a really good fit for something like a digital platform is if you've ever seen a hip or knee replacement patient education booklet or guide. I mean, it's often 50, 60 pages that an elderly patient has to go through and remember. And
Mhm.
um, it must be very hard to try and follow that to understand like what those recovery milestones are. So I can definitely see why on a digital platform where you're able to get notified at the right time of like what to do and what to expect, it's a lot easier for a patient to not have to sift through those 60 pages on their own to get that information.
Yeah, I remember back when I was working in a hospital, I saw these gigantic binders of patient education information because the fact is, there's a lot to remember and to learn to effectively manage your condition. But oftentimes I also heard from patients that there was just so much cognitive overload, and it was just so overwhelming that oftentimes they didn't even crack the book open because it was such
Right.
a huge barrier for them to get started. And just having Seamless there to give them bite-sized pieces and to coach them through that process is super helpful and kind of reduces that psychological barrier to getting started.
We also have a lot of partners who kind of use like multimedia as well. So, I mean, we have some partners who, put in like exercise rehab videos for patients, which seems like a simple thing. But,
Mhm.
when you think about how most patients are receiving kind of like black and white, photos of exercises in these booklets, people to actually see how to do those things properly, I think can make a big difference. And actually more recently, we've had some partners where because of COVID, they've had to cancel all of their, in-person, pre-op orthopedic
Mhm.
classes. And so what some of them have done instead is they've just filmed the class and then they just put it on Seamless, and you have patients who can just still watch the classes and still get prepared for surgery properly. So, and these are really simple things you would think, but not all that common in healthcare still, um, but could definitely make a big difference.
Yeah, I think typically in my inbox, I get patient feedback live, and every day I get 100, 200 pieces of patient feedback live into my inbox. And what I often see from patients, especially for the orthopedic programs, is how much they love the way we guide them through their surgery, post-surgery exercises, their stretches, their strength building exercises, etc. They love the illustrations that we're able to provide, the simple written instructions, and of course those videos as well. Oftentimes these videos are created by the healthcare teams themselves, and we're just kind of pushing it out at the right time for the patients, and they love seeing their clinicians faces on those videos. They find it very reassuring, and I'm sure now during this time of COVID, it is an extra special touch to make them feel like they're still connected to their healthcare team. So it's something that patients really love, and I'm so happy that we're able to provide that for them.
That's great. I imagine there's some other unique kind of design functions in the platform to accommodate, knee flexion, for instance, and things like that. Are you able to speak to kind of the unique design aspects that have been programmed into like an orthopedic digital patient engagement platform?
Yeah, I think I'll start that conversation, and I'll pass it over to Josh, who can probably give a few more details regarding that. But one of the coolest things I think on our orthopedic programs, especially our knee replacement programs, is the knee angle tracker and the straightening tracker. So the way it works is that there's a little guy on the screen, sitting on a chair, and you can actually change the angle of the legs of the little guy on the screen to reflect how much you can bend your knees on any given day. Same thing for the straightening one, where you have a little guy kind of sitting there with his knee straight, and you can show how well it's able to straighten out. It's a really, really cool feature, and it actually existed at Seamless before my time. I've heard from Josh that credit goes to Holland Center, who worked with Josh and Willie to put this on the system and make it available for all our programs. But Josh, do you want to add more to that?
Yeah, so I don't know exactly when this sort of idea first came up at the Sunnybrook Holland Center, but I think probably over a decade ago. It sounds like the traditional way to measure range of motion of a knee after a knee replacement was you would, I think, have the patient come in, and then the physiotherapist would actually see how far the patient could stretch or bend their knee, and then kind of use a kind of like I think it was like a protractor type of an instrument to measure that angle. And then I think one day they asked, well, we wonder if a patient, self-reported, self-measured these angles, would it be just as valid as what a physiotherapist is measuring? Because if it was like pretty good, then maybe we could have patients self-report these, and we wouldn't have to have them come back in every time just to get a measurement done. And so I think they had hundreds and hundreds of patients measure the range of motion themselves and then compare that to what a physiotherapist measured. And they found that there was very strong agreement between the two, strong enough that patient self-reported measure that was considered as valid as a physiotherapist's measurement of the knee range of motion. And so we kind of used that concept and design to inspire the way we did it in a more interactive way on Seamless. I think kind of the exciting thing is that in the past, maybe they were only measuring that, once a week or once every couple of weeks when the patient came in for physio, or maybe the patient was recording it at home on paper. But with Seamless, every time they recorded, it goes right to our back end, and we're tracking, thousands and thousands of data points of ranges of motion. And we can actually put these like really neat dashboards and graphs about, what does the typical range of motion look like throughout the recovery period. And so there's like this really unique picture now about what does the patient experience look like in recovery for a knee, which really it was difficult to get that picture before. And we're kind of with our partners been kind of innovating on that. So that's been really neat. And you can kind of imagine like the future of this is like, what if we had other interventions in your place, whether that's new implants or devices or protocols, how does that affect range of motion? And now there's a pretty quick way to analyze that kind of data. That's really
daily,
exciting.
yeah, like granular.
Absolutely.
Yeah, and I think like one unique thing that we're able to do through that knee ankle tracker is we're able to actually provide encouragement and education as a patient progresses. We can actually now let them know if they're progressing as planned, I guess, or not, and kind of remind them to do their different stretches and exercises as needed if they're falling behind in some way, and to give them really specific next steps on how to get themselves back on track. So it's a very fun, but also a very educational tool for patients as well.
I think it's a really great point, Denise, because I think one of the challenges we find with patient-reported outcome surveys in general is that you're asking the patient to give you all this data, but these survey tools generally provide like no value back to the patient. Like we're asking,
Yeah.
and then we're surprised when patients don't want to, respond to these surveys. But to Denise's point, it's really cool how on Seamless, if you tell us how far your knee can bend, we actually give you feedback on like, are you bending as far as you should be by this time in recovery? Are you behind? And then are you, so far behind that maybe you should call your physiotherapist and get it looked at? And I think what we found through our experience is that when patients actually get value from the platform, they're more willing to give that data because there's actually a value exchange there, which is unique in healthcare because usually patients just are being asked to give data and answer surveys and they're not really getting anything back. And I think we realized that you got to go one step deeper to actually make it worth their time.
Exactly. And at the end of the day, that is actually that's the magic sauce for patient engagement. In order to get patients engaged at every step, we just have to provide value. And if you provide value at every step, naturally patients will continue to stay on the platform and engage on a day-to-day basis. And I think that is the key to the success that we've had at Seamless of getting people of all age groups involved in our programs is we keep talking to patients and asking them what they value, and then in turn providing that on the system so they'll continue to want to engage with us.
Absolutely. Can you talk a bit about kind of some of the tracking that we're doing for opioid use for something like an orthopedic surgery? Like what are we typically tracking and what sort of feedback might patients get through that experience?
Yeah, we're very fortunate to have a very talented pharmacist on our patient education team. And she's done a phenomenal job of really fleshing out our simple opioid tracker into something quite magnificent now. So now in our programs, we're actually able to educate patients on the difference between opioid and non-opioid medications. We teach them how to take the non-opioid medications regularly, so they only need to rely on their opioid medications as needed. When they do take their opioid medications, we're actually able to track how many tablets or pills they're taking on a day-to-day basis, and to provide some coaching and feedback if it exceeds the recommendations that their clinical team is giving them. On the clinician side, we're actually able to provide really great charts and data for the clinical team. So they are actually able to see how their patients are using their opioid medications on a day-to-day basis. We have Javon, amazing data scientist, who is able to make these graphs and convert everything to morphine equivalents. And so it's very useful tool both for the patients from an educational standpoint, for managing this pain and the medications, but also from the clinician standpoint, they're able to get amazing data through the tools that we have.
That's really cool. And it reminds me how I think sometimes like when organizations are looking at digital patient engagement for the first time, I think there's a misconception that all you're doing is just delivering the booklet digitally.
Mhm.
But like we're talking about some pretty like robust, like complex workflows and algorithms and data collection. I think in some ways, things they haven't even thought of doing before. I think that's the really cool part about this. I mean, I think there's probably a lot of workflows and designs and things we haven't even thought of yet that we're going to
Mhm.
figure out over the next couple of years and innovate on. That's really exciting.
Mhm.
Yeah, for sure.
Yeah, and Denise, I love how you're using the words like coach. It's coaching the patient along, and it's personalizing that experience based on what they've actually entered into the platform, what their condition actually is. You also mentioned, making the platform as valuable as you can for patients by asking them, what did you value most, and how do we deliver more value to each patient? I'm sure you mentioned you have 100, 200 email messages every single day from patients. What type of things have patients valued the most from SeamlessMD and from their experience with the ortho program on Seamless?
I definitely get the most comments with like very excited exclamation marks about our exercise coaching. So every week, our exercises refresh on the system, and they're actually taught new exercises as they proceed through their recovery. So they're able to watch the videos, look at the illustrations, and read the instructions. And patients absolutely love that. They find it so exciting, so engaging, and they always have their phones in their pockets, so they can actually carry the instructions with them wherever they go, whether they're at home or not. They'll always have access to those instructions, and they really appreciate that. The other thing they really love is that we track the exercises that they actually end up doing. So we have a progress chart where they're able to see every day how they're keeping up with their different exercises, how they're progressing with their stretches. And patients have said that, it's really encouraging to see, like on the charts, on the graphs, the progress that they're actually making. They can see that their pain is decreasing day by day, and they know that they're getting closer to their goals. And that's what they really love about the program, is how positive and empowering that experience is for them.
Yeah, it sounds like it keeps them and holds them accountable as well. Like they see how they've recovered so far, and they know the milestone they need to hit. So in a way, it is like a coach in your pocket where you have this accountability partner.
Exactly. Some patients have said in their comments that there's some days where they feel a little less motivated, maybe a little bit more tired. But the fact that, the app will remind them on that day, hey, these are the exercises you have to do today, keeps them accountable and keeps them on track for their exercises. And, they're actually really grateful to have that coach in their corner.
Mm-hmm. Josh, did you have anything else, or otherwise, Denise, I know you're familiar with our Fast Five lightning round. I can jump over to that. All right. So Denise, I wanted to change up these questions. That way I'm not giving you the exact same ones as last time. So question number one, what is something that you believe that others in healthcare might find insane?
God. I think that is a stretch for a lot of scientists. So yeah, that one.
That's fair. Yeah. Question two, how has a failure, and this is taken right from Tim Ferriss's book, but how has a failure or apparent failure set you up for later success? And do you have a favorite failure of yours?
Yeah, I think if I was going to find my favorite failure, and probably my biggest one, I've been reaching all the way back into my childhood. When I was a kid, I actually really wanted to be a vet. I really love animals, still really love animals. And, my whole life I had been working towards, applying to vet school. And I think just about maybe 6 months or so before applications, I suddenly became extremely allergic to cats, like to the point where like my eyes were completely swollen up, and like my nose was running a lot. And this was a huge, devastating blow to me. And, I was, young, a teenager at that time. And I was thinking, oh no, this must be, divine intervention. It's not meant to be. And I was actually quite sad for quite a long time. And my motivation for school and all that dropped for a while. So when university applications actually came, I just applied to a bunch of really random programs that I thought might work out. So I applied to business programs, I applied to early childhood education, I applied to nutrition, and thank goodness, I ended up in human healthcare, in nutrition first. And I guess they say the rest is history, but I would count that as the best failure that I've ever had. And it's put me on this amazing path to help so many people in healthcare. And, now I still get to run my dog bakery on the side.
Denise, that reminds me of how when Seamless first started, we tried doing Seamless Vets in parallel because human healthcare was so hard.
Yeah.
Well, we
It's
tried,
not too late.
and then we failed. So now we have to do human healthcare in Seamless.
It's parallel to my journey.
It is, yeah. It's kind of funny.
So what you're saying is, in an alternate universe where Seamless Pets took off and Denise became a vet, she's using Seamless Pets as a
well, no, more like we would have met anyways, because in the alternate universe we're both doing pet stuff.
It's destiny.
That's great. Question number 3, Denise. Would you rather have invisibility or super strength?
Wait, how strong are we talking about, Alan?
As strong as like Superman.
I definitely would choose invisibility. I'm a huge fan of Harry Potter, and a cloak of invisibility sounds amazing. So that's definitely on my list.
That's a good answer. Yeah.
Wait, Alan, what would you pick?
I would choose invisibility as well. I just think that's a fantastic skill to have. Imagine if you could turn invisible as opposed to just super strong. It's like, you can lift stuff.
You can do any movie you wanted to. You could sneak
you can do anything. Yeah, almost anything you want. You're only limited by your own speed, and that's about it.
And quietness.
Yeah, I mean, if it was a question for me, I would probably change the question and say, let's choose 2 different skills, but that's what we went with.
What about you, Josh?
Oh, man. I mean, honestly, probably invisibility, because if I had super strength, what would I do with it?
Exactly.
Go to world's strongest person competitions? What am I doing with my super strength?
Yeah. Question number 4, Denise. What is your favorite movie?
So really great question, because I married a filmmaker, so he'll probably judge me on my answers. But my favorite movie is Forrest Gump, which is also his favorite movie. And a close second is The Sound of Music, which is a classic.
Nice. Yeah.
And everyone in my family loves that one. I grew up singing those songs in my living room, so they're definitely close 1 and 2.
That's brilliant. Last question that I have. How much wood could a woodchuck chuck if a woodchuck could chuck wood?
So I prepared for this one and I Googled it. So apparently it's 700 pounds.
I did not know that. I was not prepared for that answer.
Google did.
700 pounds.
Hold on. Wait, did they do a randomized control trial of woodchucks to see?
Apparently a biologist did an estimate.
No way. 700 pounds.
They actually did.
Wow.
Yeah. Must have been a fun project.
Yeah. I kind of love that there was a formal analysis and a real theory behind this. I really, really enjoy that.
Classic nerd answer, right?
No, it's perfect. That's so good. Well, awesome, Denise. I'm looking at the time. We're out of time, so I'll end it here. But I do want to thank you again for being on the show. This time, highlighting all the success that you've built into the program for orthopedic patients and patients using digital patient engagement for total joint replacement. It's kind of a great stepping stone from health literacy and now diving into exactly the specifics that are put into the program. So I think our audience would definitely value that. And Denise, I certainly did. So I really appreciated the conversation today. Josh, you as well. Thank you so much for being on the show.
You got it. Thank you, Denise. Thank you, Alan, as always.
Thanks for inviting me.
All right. See you, Denise.
Bye.